Dan the Natural Man Show. Hello, it's Thursday. Today I want to talk about arthritis, specifically osteoarthritis and rheumatoid arthritis. I know there's a lot of forms of arthritis, but these two are some of the most common forms. We want to talk about some lifestyle changes that we can make to ease the pain of these conditions. I even have a book and there's somewhere called The Cure for Arthritis. And this was back in Europe. This is when Europe had these health spas. And they were helping people actually heal their arthritis with juice fasting, exercise, steam baths, distilled water sometimes, and adopting a plant-based diet when they're finished. So we start with the food. Arthritis is inflammatory. It's an inflammatory condition. And I've talked before on this channel about inflammation. Low-grade chronic inflammation is the driver of a lot of our modern day lifestyle disease. So we talk about the plant-based diet because it does a really good job. A healthy, whole food plant-based diet with not a lot of junk food. We're talking about whole plant foods, fruits and vegetables, nuts and seeds, beans, whole grains, things like that. These foods do a really, really good job at lowering the inflammation in the body. A really good job. So there are a lot of people that went on a plant-centered diet, and they have completely got rid of their arthritis pain. There's a doctor, MIT-trained spinal surgeon, who was doing spinal surgeries on his patients. Some people would do better, some people would help a little bit, some people the pain would come back, some people it wouldn't help at all. But he was a busy surgeon, so some of his patients their surgery was scheduled 3 months to 6 months out. And some of these patients, before they needed the surgery date, they would call us out, need the surgery anymore because my pain is gone. So he started to talk to these patients and see what they were doing. And he noticed common themes with these patients. A lot of them were going to a plant-based diet, a more plant-based diet. They were doing more exercise, things like that. So we had to look at an inflammatory diet, which is a whole food plant-based, does a really good job at this, a very good job. Next thing we got to look at is our hydration. We want to make sure we're getting enough water every day. If we're dehydrated, it will increase the pain in the joint because the joints need lubrication. The body uses water to make lubrication for the joints. We had to have water. Next thing is sleep and stress. I combine these two because if you're stressed out a lot, it can affect your sleep. But we have to sleep. If we're getting enough sleep, 7 to 9 hours a night, it's going to help our body repair itself a night. It's going to lower the inflammation in the body, lower the inflammation in the joints. If we're stressed out, we need to do some deep breathing, some meditation, some prayer, whatever it takes for you to calm down. Because we want to be sure we're getting enough sleep. The next thing on the list is exercise. And I've had clients, I don't exercise because it hurts. And I'm not saying it doesn't hurt. But we're talking about, I take baby steps. I know how to take baby steps with you. If your knees are hurting, I recommend getting on a stationary bicycle, putting it at the lowest level, pedaling very slow. You want to pedal long enough to work up a sweat and to get the circulation going. This will help your joints feel better. This also helps with tight muscles, with muscle strains. When you get the body temperature up, you get the blood circulation moving. It will help these joints feel better, and it will get more blood to the joints so you can get more healing nutrition to the joints. Cartilage, tendons, ligaments have a low blood supply, so we need to move the body to get more blood nutrition to these vulnerable areas. Next thing on the list is your strength training. Yes, I highly recommend getting a coach to show you how to strength train, period, especially when you have arthritis. But when you learn how to squat or leg press or whatever you can do without knee pain, say you have arthritis in your knees, when you build the muscles around the knees, it's going to help that knee feel better. It's going to take stress off of that knee. The muscle is going to take stress off of that knee. Same thing goes for your back and your spine. You want to build the muscles around the spine. You want to build muscles around the shoulder joint, around the elbows. I've had clients with really bad pain, and I've helped them get out of that pain by following this plan of eating more fruits and vegetables, doing the exercises that we can do to build the muscle, build the circulation. Next on the list is going to be your herbs. I recommend highly for this condition Dr. Christopher's Complete Bone and Tissue, the one that you take orally, also the oil or the cream. You want to do both. You want to take it orally and use the cream on the painful joints. Also, you stack that with his joint formula. You take it orally. And if you want even more relief, use his cayenne cream. Cayenne pepper cream actually blocks the pain signals. And it also increases blood flow to the joints. Also recommend cayenne pepper in your mix here because it increases the blood flow. He also has yucca in one of his formulas. Yucca has been shown to be highly anti-inflammatory, yucca, but it's in his formulas already, so you have to go and find yucca. He makes it easy with his formulas. He's got a lot of great formulas. So movement, whole food, plant-based, anti-inflammatory diet, herbs, water, exercise, and sleep. And stress reduction. Stress interferes with all of our healing endeavors. If you like this video, if you found this video helpful, please like and share it. Subscribe to my channel. If you got questions, ask them below. And remember, until next time, keep it natural.